welcome. I'm Dr. Lianov, and I'm the president and founder of the Global Positive Health Institute, and this is the GPHI podcast series where we explore all things related to healthy lifestyles, positive psychology, and positive health. And today I'm really excited to have a longtime colleague and a dear friend, Dr. Wayne Dysinger. He is a lifestyle medicine physician, founder of Lifestyle Medical, and chief medical officer of Blue Zones Health. He was also a past president of the American College of Lifestyle Medicine and the founding chair of the American Board of Lifestyle Medicine, and many more things. So welcome, Wayne.
Great to be here, Liana. Thanks so much for the privilege of being with you in this podcast. And as you said so well, it's great to be here from a colleague perspective. It's also great to be here from a friend perspective.
Yes, and I thank you so much. And I can't wait to dive in and hear your thoughts about some of these questions that I've asked a series of colleagues in lifestyle medicine and positive psychology. And it's interesting how it's a bit of a Venn diagram. We have some similarities and some differences. So what first grabbed your attention to lifestyle medicine? And then as you answer that, think about, I know you have a love of positive psychology and positive health, and see that that also has a role in comprehensive healthy lifestyles. So how did all that evolve to grab your attention and say, this is what you want to do as your medical career?
Yeah, thank you for the question. And what first grabbed my attention as far as lifestyle medicine was recognizing that, number one, it worked. So you could really reverse chronic diseases by a few simple lifestyle choices, a few adjustments to your diet, to your exercise patterns, and you could do that rather quickly, and you could do that very effectively. So knowing that it worked, that was huge. That was super important. The other thing that was important to me, because I was an academic at the time, was that there was research behind it. So not only could I see it in front of my eyes as I watched certain, it was actually, back in those days, there was something called the Coronary Health Improvement Program, or what later became the Complete Health Improvement Program. So I watched a few of those being run and watched the clinical outcomes. But then I also recognized that there's plenty of papers published on not only the Complete Health Improvement Program, but the work of Dean Ornish and Caldwell Esselstyn and Colin Campbell and some of these pioneers in the lifestyle medicine world. They weren't just good thinkers. They actually knew how to do good research and get papers published. And so it worked, and there was good science, and that meant a lot to me, those two things. Positive psychology, what first grabbed my attention as far as positive psychology was I literally think it was you, Liana, at the conference in Denver. I think it was in 2012, where you gave a talk on the tools to actually make lifestyle medicine work from a behavioral health perspective. So it's one thing to tell people to eat more kale. It's another thing for them to actually start eating more kale, right? So how do you get them from the idea to the action? And you talked about three things. The first one was, I think the first one was motivational interviewing. The second one was cognitive behavioral change. And the third one was positive psychology. And I didn't know a lot about positive psychology then, but you helped teach me there, and I've read a lot since then. And so I became convinced that positive approach to giving people feedback really worked and was really valuable. And I could go on and on. I have something else I definitely want to say, but I'm going to stop there because those are what first grabbed my attention as far as positive health and lifestyle medicine.
That's great. And you have such a great memory 12 years later. But I used to give those health behavior talks and behavior change talks, and I would call it that three-legged stool. Exactly. Motivational interviewing, kind of behavioral techniques and positive psychology. So thank you for remembering, and I'm glad it made a difference. So before we go more into how we use this professionally, etc., I like for the audience to get to know you better as a practicing lifestyle medicine physician who believes in all of comprehensive healthy lifestyle, how you're applying it in your own life.
Wow. It's probably a little more compulsive than it needs to be, but I have a whole system wherein I try to keep my health balance in my life, basically. So it came from a lot of different places, but much of it's just what I evolved. But some of it's around the social components of my life. So connectedness is really important. And so I work on my friendships. I work on my family relationships. I work on my community relationships. So that's one piece of it. Another piece of this system that I have is you could call it my mental health or my emotional health, my spiritual health, whatever you want to call it. But it's looking at those areas, and within that space, I try to meditate. And I'm not very good at meditating, but I'm getting better. It's meditation is like exercise. If you don't practice it, you don't get better. So within there's meditation, there's certain readings I do, I journal. There's a variety of different things that I do to try to keep balance there. And then the other sort of arena that I check is, the classic lifestyle things like eating and exercise and sleep and those kinds of things. And so I sort of track on a daily basis how well did I do eating today? How well did I do with strength training or with stretching or with cardiovascular training? And how it sort of plays out in real life is I have a friend. We go running together, and we fine tune with each other. So I'll tell him this is how I'm doing in those areas, and he'll tell me this is how I'm doing in those areas, and then I'll say, this is what I want to do next week to improve, and he'll tell me this is what I want to do next week. So it plays out that way, and I find that I'm not as disciplined as I'd like to be just on my own. But if I have someone beside me, I'm way more likely to achieve what I'm after. So that's what I do, and I appreciate this system. Again, it's a little OCD, maybe a little compulsive, but for me, I think it works. But I'll tell you this. Because I was raised in this sort of environment where the better, I had to look good, sort of the more perfect I was, the better I was. I consciously say my goal is to hit 80%. So if I find that I'm going way more than 80%, I'm like, man, you're getting out of balance. You gotta downshift. You gotta let go of a few things. But if I find I'm doing less than 80%, then I'm like, well, maybe I could improve here or improve there. So probably the biggest thing that I would say is don't try to be perfect. That ends up being more harmful than helpful. So go for 80%. If you hit 80%, you're doing really good.
I love that because, of course, the principle in positive psychology is having self-compassion. And what gets in the way for a lot of individuals is that they know what to do. They may work hard on it. And of course, we're all human. We slip up. We don't quite meet our goals. And it's sometimes then leading to a downward spiral rather than just taking a deep breath and having that self-compassion. Okay, let me regroup. Let me reevaluate and see what I can improve within reason. And that's a general piece of advice that we can apply in all aspects of our lives, but particularly in our health and well-being. And so you've put that very nicely. And I honestly haven't heard anyone say that they have a system in place, but for some people, they need a system. So this is great. You may inspire people who will be thinking, oh, I haven't thought of my own self-care system. Let me see if I can arrange that. So that's terrific.
So my first idea for the system came from something called the Personal Craziness Index. So you can Google it, Personal Craziness Index. And the Personal Craziness Index isn't what I do, but that idea started from that.
Wow. Can you explain a little bit what that is?
It's the I don't even remember all the details of the Personal Craziness Index, but it was basically something that said, if such and such is happening, then you're likely not in real balance at that moment.
Mm.
So things like if you're getting less than 7 hours of sleep a night, then that's a problem. You need to relook at things. So it was that concept, and I sort of, in my obsessive compulsive way, took it and sort of made it something else. But anyways,
Made it your own. Yeah, but it's good to think of to be on the radar for being out of balance. So that's great. Yes. Well, let's shift gears, and I have seen you evolve and grow over many years professionally. So there's a lot to cover in a short amount of time, but tell us your road of lifestyle medicine and what's happening now, how you're using and practicing lifestyle medicine with positive psychology elements in your profession and your career.
Yeah, I was trained as a family medicine physician. That was my first training. And then I went on and got additional training as a preventive medicine physician. Then I got into academia. So I spent my first half of my career, or 2/3 of my career, in academia. And that's where the whole lifestyle medicine knowledge started. I was working at Loma Linda University, and that was a good place to be as far as where lifestyle medicine was getting started. And so I became passionate about lifestyle medicine, but I was watching. We were training our residents around certain lifestyle medicine principles, and my residents would go out and they would say, Dr. Dysinger, you trained me how to do this, but where's a job where I can actually practice doing it? Where I actually get a job doing lifestyle medicine. And then the American College of Lifestyle Medicine was growing. And as people walked into the American College of Lifestyle Medicine, they would say, there'd be this big sigh and this, I'm so happy to be here. This is my tribe. These are my people. This is what I really wanted to do when I went into medicine, is lifestyle medicine. But then the next thing they would say is, how do I make a living doing this? So long story short, I had this unique opportunity to start my own clinic and sort of say, could we actually show that you can practice differently and make a decent living doing it? And took a lot of work. To be honest, I was pretty naive and I had a lot to learn. But for whatever reason, I stuck with it, and we learned a lot, and we ended up having some success. So now we have 2 clinics, and then our clinics just merged with a larger organization. And that larger organization has taken the science of the lifestyle medicine world and the economics of value-based care and merged it with the public movement of Blue Zones. So we're now called Blue Zones Health, and we're trying to bring those 3 together: the science and the economics and the public knowledge, and say, hey, there's a way that you can do healthcare differently. So that's sort of the big picture from a lifestyle medicine perspective. Now, if you look at what's evolving from a positive psychology perspective, as you know, because we hired you, to help us create a positive psychology foundation. And as we look at it, for us, positive psychology actually comes before lifestyle medicine, because if people don't know their purpose and meaning in life, if they aren't in touch with what makes them feel good and what makes them feel valuable, then they're going to have a hard time making the health behavior changes. So if that's not identified, so we start there actually, and I would say if you went through my charts, I don't know what percentages it is, but it's a very real percentage, maybe 20% or so of my charts. In the summary, I will literally put positive psychology. And what that is, it's maybe not, I mean, you're sort of an expert at positive psychology, so it's probably like way too simplistic. But what that means to me is I complimented that person. I spent a lot of time telling them that they're doing something really good, that they lost weight, or they lowered their cholesterol, or they did something, they started sleeping better, whatever it is. They connected with people more. And I'm telling them, you're doing a great job, keep it up. You're doing a really good job. So whenever I put positive psychology, that's because a lot of the visit was literally that kind of thing.
Well, that's a good place to start, connecting with our patients in that way, because really positive psychology now is evolving recently into positive health, which fits into this holistic. We've all been interested in holistic care. So it's person-centered, whole health care, and positive psychology is a huge piece of that. And at the heart of that is what you're describing, is you're connecting with your patients, listening to where they're making good progress and using that as a springboard for nudging them forward, advancing their success and creating a healthy lifestyle. So that's terrific.
Yeah, it's so cool to be able to do that, because if you're a physician in a 15-minute visit rat race, you can't really do that. But we have half-hour visits, and we have just this whole system that allows us to do some of that with our patients on a regular basis.
Yes, well, the lifestyle medicine community has been working so hard on this reimbursement issue, and it's still a struggle. And there are systems like value-based care systems that really support true lifestyle medicine with embedded positive psychology and all of that holistic care. So this is exciting. And of course, as you know, I'm an advocate and we're both advocates, and many of our colleagues, to expand this, and we're making progress in that way. And that sort of leads to a question of, well, two questions for any of our listeners who are not already doing what they can to incorporate healthy lifestyle prescriptions, positive psychology prescriptions with patients in their health professional roles. And we have physicians and other wide variety of health professionals who are listeners as well as patients. How for closer to this ideal of lifestyle medicine with positive psychology, what advice do you have for them?
Yeah, I mean, I think the first things that I would say is, keep following your dreams and be persistent, because I certainly didn't get to where we're at, overnight. And my experience going through life is you never get there without a little persistence and a little sort of just belief in yourself and belief in things that you're passionate about. So that's probably the most important thing, which is just, and if you need someone to be beside you to help you be persistent, then do that. But that matters a lot. You'll figure out, if you're persistent, you'll figure out ways, right? So the American College of Lifestyle Medicine has lots of resources as far as reimbursement and different tools you can use. So you can push into that. My personal experience is that the value-based care reimbursement model is what works the best. So getting paid on a capitated basis rather than a fee-for-service basis. I'm a huge fan of that. And that's widely available in a variety of places around the world, actually. But in the U.S. specifically, certainly in Medicaid managed care, or Medicare Advantage or HMO Medicare, you can get value-based reimbursement there in most places, or at least in a lot of places. Another way that people are doing that is in direct primary care. They're getting value-based reimbursement there, so that works in some scenarios. So if you can find a way to do value-based care reimbursement, or sort of a capitated reimbursement rather than fee for service, I think that helps a lot. And I mean, I could go on and on, but use a team as much as you can. You actually don't have to be a doctor to prescribe lifestyle medicine. Your mom did that to you all the time. So you can offer good care without the cost of a physician. Physicians are really costly. So just keep some of those things in mind as well. So I don't know, I could go on and on, but those are
great.
starting
No,
places.
I love it.
Yeah.
No, that's sound advice. And I love to hear your vision, especially as we've worked over the years to expand lifestyle medicine and really impact globally healthcare and self-care in this way. If we succeed, and we're making a lot of progress, but there's a long ways to go, a long way to go. But what would that future look like if we're fully successful with this lifestyle medicine process of healthcare and fully embedding it in what we do?
Well, the first thing is, I tend to be optimistic, and I tend to dream in ways that maybe aren't always realistic, but if you really believe them and you sort of keep moving that direction, there's amazing things that'll happen. But so I sort of talked about our clinic being rebranded as Blue Zones Health, primarily because we wanted people to understand who we were. And we were using the term lifestyle medical, but lifestyle medicine, people don't know really what that is. A lot of people don't know what Blue Zones Health is either, but we did the research, and 10 times more people knew what Blue Zones was compared to lifestyle medicine. So that was a piece of it. But as we've been sort of pushing into that, we've been spending time looking at Dan Buettner's summary of Blue Zones. These people that live better longer, these people that live to 100. And if you look at what they call the Power Nine, the 9 things that Dan Buettner summarizes as these people do, at least more so than the average population. The biggest piece of them fall in the connect category. So relationship and connection and all of those kind of things are super, super important. And then as we thought about that more, one of the places people get connection is in their spiritual home, so whatever that is. And it can be some big church, or it can be, just your own little group or whatever, but that connection. And it's not just horizontal connection, it's also vertical connection. So as you think through all those things, and you think of healthcare now, and then you sort of start going back, well, what did healthcare used to be like? Well, back in the day, it was your shaman or your priest or your druid or somebody else. There wasn't, the idea of a doctor didn't even exist. But the point is, back then, people sort of recognized that health wasn't just this scientific concept of figuring out what was broken and then fixing that broken thing. And it's still true. When we're unhealthy, it's not that something's broken, it's that our journey sort of got us out of balance a little bit. And so as a physician, and as a Blue Zone's health ecosystem, our job is to bring people into balance, and focus on things like relationships and things like purpose and the whole positive psychology world. That's our job, really. And yes, maybe we need to tell people to eat less cheese so their cholesterol will go down, or maybe we need to tell them to use gooseberries to help, but the biggest thing is those pillars of relationship and moving more, those kind of things. So all to say, I think the future of healthcare is actually not going to look like what we currently call healthcare. It's going to be something that's more of a community building. These are the health secrets that we share amongst each other. And then we'll still need to send people to the urologist because their prostates are too big, or to the whatever, the cardiologist because they've got an arrhythmia or something. So there's still going to be those specialists that are going to need sort of that, what I call the allopathic reductionistic approach of fixing things that are broken. But the core chronic disease model is not going to look like what it looks like now. It's going to be relationship centered and sort of lifestyle centered, and doctors will be involved, but it'll be a whole team. So that was obviously something I'd like to talk about. So I went on.
It's so lovely, and music to my ears because, we have that, both of us have this background in preventive medicine and public health, and we very well aware of that community influence and to be thinking around population health. And that's really what you're describing is and Blue Zones is that. It's community health without the healthcare providers. And so that's making the whole world be a Blue Zone would be amazing. So I love that. What are your favorite resources? We're winding down. Our time is almost up, but there's a couple of your favorite resources you'd like to share with our listeners.
Yeah, I do a lot of reading. I do a lot of spiritual reading actually, and so I push into books. I one of the books that I read recently that I really like is Lighter. I don't know if you've ever seen or heard of that book. It's by an author. He uses a pseudonym, Young Puebla, but it's a really good book. It's a positive psychology approach to life. I think a resource that I use a lot for my patients is the whole 12-step world. I think there's a lot of spirituality in that world, and most of us have certain things where we're sort of stuck in patterns, and the 12-step world is the best behavioral health. I mean, there's more people it's the most successful behavioral change program in the world. Alcoholics Anonymous is. Yep. So I like to push into those. What else do I use? I don't know if I'm very systematic in that space. It's more this resource here and that resource there. But I mean, we in our office we keep books and we keep them out. We have a bookshelf in the exam rooms, or the consult rooms, and people pull. They love the Tiny Habits book or the How Not to Die book, and some of these kinds of things. So yeah, those are some of the resources that we use.
That's terrific that you have these books out there for the patients to see. So yes, of course, there are evolving resources all the time, and the science is evolving both in lifestyle medicine and positive psychology and positive health. And pretty soon, I think we'll have a lot more of this at our fingertips with technology, and it'll help us to customize the best resources for ourselves as health professionals as well as for our patients. But those are some good recommendations. And as we close, then my final question always is, what is like one key message you would like to leave our listeners with?
I actually think it would be take care of yourself. It would be understand who you are, understand your journey through life. All of us have traumas that we experience in life. We all have things that were blessings to us, that helped us in the good parts of our life, but we also have things that were hard for us. And for us to be present to other people, we have to first be present to ourselves. So if you haven't sort of done your own internal journey, spend time doing that, whether it's with a friend or with some professional psychologist or whatever it is, spend time on that journey, because that's what's going to really allow you to do what you want to do for yourself as well as for other people. I mean, I think service is super important, and you can't serve others until you've served yourself. And then I already said, just be persistent, just hang in there, find the right tribe, and like I've got Lianov in my circle, and I can go to her, and she'll support me, and I'll support her, and we need people like that. So probably that's where I'd say to start.
Well, thank you. Thank you so much, Dr. Wayne Dysinger, for joining us for this
Thank you.
GPHI podcast, longtime colleague and dear friend. And thank you to our listeners. If you haven't subscribed already, please subscribe to our GPHI podcast channel, and hope to see you on another one of these in the near future. And in the meantime, be safe, happy, and well. Until next time, take care, everybody. Bye-bye.